Zahn is MD for the System Vice Chair for Physician Well-Being at Mount Sinai in New York and author of the book Choose Happiness, A Guide to Practical Perspectivism and Happy Daily Living. Perspectivism, I had to practice that word. Jeff is a former anesthesiologist and qualified MBSR teacher, and he now teaches mindfulness and wellness strategies across the Mount Sinai system and beyond. Jeff, welcome. It's a very, seems like a big transition going from anesthesiologist to suddenly promoting and teaching happiness. How did you make that transition and what inspired that?
Well, first off, thank you all for being here with us. Thank you, John and Tanya, for having me. It's not so much of a transition at all if you think about it in the way that, as an anesthesiologist, my job is to take care of the individual's well-being in front of me, right? So
That makes sense.
physically or psychologically, both apply. And in fact, in becoming since I've had this bent towards well-being and looking after my own and others' well-being for most of my life, my draw to anesthesia actually started from an observation of how, when I was a medical student, how a resident had made a patient preoperatively feel comfortable and feel okay and take away some of the fears, allay some of the fears of the upcoming surgery that she was about to have. And I recognized that in that role for the anesthesiologist was a quality that I enjoyed, was a quality that I had, that I loved doing for people to be able to take down their stress level a little bit. So I was practicing that every day in my medical career, as well as the transition to just looking after my trainees and faculty's wellness was an easy one.
Wow. Was there anything that happened in the world or in your life personally that made you really focus on the happiness side of life?
Oh, well, that would really take me back to my teenage years when I was just, standard angsty, 16-year-old going through high school and realizing that I didn't want to let my friends, the world situation, whatever was going on socially affect my own happiness. I said, that life is crazy and that's all going on out there. And I've always felt that my happiness, my source of that was within me, and that I could always find it if I looked for it in myself and sort of let go of my, I call it, attachments to the things going on around me, that others were going to do what they were going to do, and I should choose to do what I wanted to do, and what I wanted to do was be happy. So be calm, be less stressed and even tempered. And so I made that decision really in a flash, in a moment, and then found ways found ways to live that as continuously as I possibly could. So the start of this me really happened a long time ago.
I think back, Jeff, when you were going through this at a younger age and some of the disruption that was going on probably around there, maybe the Vietnam War and stuff. There was no social media like they have now that gets people fired up and all of that right now, and how crazy it's going on. What are some suggestions that you can do to help us in dealing with that?
Well, thanks. That's a great question. The easy one is to say stay out of that as much as possible. But that's not really a solution. It is one, because that triggers us. Every time we look at another article, we're triggered to get a little angry, crazy, upset, react with disbelief. But even if we do want to engage in that way, and it's okay to recognize that, again, the world is doing what it's going to do. And our source of happiness, our source of stability and peace individually is to choose to do what we want to do. And if I want to be angry, I can be angry, and that's okay. We can choose whatever emotion we want. But if I don't want to be angry, if I want to be active in a different way, I can choose to do so as well. And that really just takes this gets us into practical perspectivism. That really just takes thinking, imagining, creating in our own minds how else I might be able to look at this situation. What else might I be able to do that will bring me some sort of control, some sort of power, autonomy over my own self within my own capacities as an individual.
Mm-hmm.
I'm still stuck on the fact that you decided as a teenager to just flip the switch. Uh, we could all take lessons from that. Our kids could all take lessons from that. What would you advise us as realtors, as people, as parents to help others in our life learn how to do that as well?
Great question. So the amazing thing is, yes, I was fortunate and lucky to stumble upon this young, but the remarkable thing is that when I did so, it felt really good. So the feedback, the process was immediately gratifying. And not only just did it feel good, it helped me be more productive, more engaged, more active, rather than there's almost a sense that one would withdraw by tuning out the world outside. But no, it actually allows us to be more involved, to see things a little more clearly. So it worked. And that was the feedback that I needed to keep doing it, if you will. And what the doing is to, and this came much later in my life as I learned the field of mindfulness and teaching mindfulness, is that we have to notice how we're feeling. And once we notice how we're feeling, sort of decide whether we like how we're feeling or not. And once we decide whether we're okay with how we're feeling, keep doing what you're doing. But if I'm not okay with how I'm feeling, then I want to feel differently. And then I start to examine how else I can look at whatever my situation is, whether I have to create, new perspectives on it myself. I'm just thinking about, it's the, being in somebody else's shoes, right? But what's it like? How would they look at it? How would I look at it if somebody else were going through this situation or feeling these things that I'm feeling? Well, how would I work with them? How would I treat them? What would I say to them? And then taking on those perspectives for my own self, because they're valid perspectives. They exist out there. I don't have to, nothing out there in the world is forcing me to look at any given situation only one way. There are an infinite number of ways to look at most everything, and there's validity in most of those ways that we can look at it. So I just have to then pick and choose, use my imagination, pick and choose how I want to look at this, which will lead me to different feelings and lead me to feel a different way. So the first step is noticing how I'm feeling. And then I like it, stay. I don't like it, change how I'm looking at it.
So, and thank you, Jeff. The so much now has also come out about how stress and anger causes so much health risk and concerns with our health. I mean, our guest last month talked about the pharmaceutical companies, and and looking at what you're saying is, that mentally and going through happiness and these stuff instead of using a pill or a drug to help you achieve that happiness. Is that what I'm feeling a little bit?
Absolutely. And so that leads very nicely to sort of the second positive feedback in this process of living this way. If one takes it on as a way of living, as being as I like to say, being a perspectivist or living perspectively, is that I know, and science has borne this out over the last couple of decades now, the research is thick and seems quite real, is that there are numerous physical, not just psychological, but physical benefits to managing our stress better, right? And on the one hand, it's okay to manage our stress however we want to, as long as that management is not a destructive, self-destructive management as well. For example, drinking or smoking, can be a way to manage stress, but it's also physically harmful to ourselves, right? So being a perspectivist, being able to know that not only am I going to feel emotionally better by looking at something differently if I want to feel differently, but I'm going to be doing my physical self better by lowering or managing my own stress. One of the most important situations in my life happened not long after I started thinking this way, and I found that it was an important feedback for me. I was 19, 20 years old, and I lost my mother to Hodgkin's lymphoma. Now, she was 48 years old, and nobody should have been dying from Hodgkin's lymphoma back then. It was treatable. But her disease, her Hodgkin's, was completely masked for a decade by her IBD, her Crohn's disease, which we know now is very much, and we knew even then, is very much stress related. Intestinal disease has many causes, but stress exacerbates it. So for years, she was going through treatment for IBD, and she was a worrier. She worried about everything. She was a lovely lady. She was happy most of the time, but she worried deep down inside her. So there was a stress level that was constant for her. And ultimately, in my worldview, her stress, her masked her underlying cancer. And so by the time they found it, it was untreatable. And so in my short version, stress killed my mother. So being less stressed was a way for me to manage my own physical health and know that it was better for me in that regard as well. So it was an important third feedback for me, not just I feel better and mentally, I feel better physically. It works for me engaging in my life, but I know that I'm really doing myself a service physically.
Wow, that's some big life lessons at an early age. How do you use that to teach that? So you're teaching within the hospital, is that correct? Am I understand?
Yes, that is correct. In fact, we just started, since we last spoke, we just started another cohort of the 8-week MBSR course. MBSR is Mindfulness-Based Stress Reduction. It's a course created by Jon Kabat-Zinn back in 1979. Brilliant curriculum, taught worldwide. The teacher training is very careful to make sure that we all teach the same sets of things, even though we can, as teachers, embellish them and present them from our own point of view. But the curriculum is very standardized. So we just started teaching MBSR. It's free to the faculty and the trainees, the residents and the fellows. And we open this up to the 8-hospital system of Mount Sinai medical system.
That's awesome. What's the not turnaround, but are a lot of people jumping in on that? How's that being viewed?
So we started teaching it back in 2018. In fact, I was a student in the first cohort of that and just fell in love with that. That happened about 4 years after I published Choose Happiness. And in the research for Choose Happiness, I did stumble upon mindfulness and MBSR. And I didn't have a meditation practice before then. I didn't really know much about it, but found the stress reduction clinic and found the work they were doing and thought it was very similar to what I was purporting with practical perspectivism. And to sidelight for a moment, the idea that we have to notice first how we're feeling, and then remember to do something about it if we want to choose to do so. So they went hand in hand. So I was a student in the first cohort back in 2018. Since that time, I started teaching it in 2020 in the midst of the pandemic. Since that time, we've trained over 200 or up to like 250 faculty and trainees in the 6-7 years that we've been doing it. And they are out there in our medical community also sort of spreading the ideas behind that, spreading the stress reduction thoughts that go along with it and the practices that can be used.
That's cool. So you weren't using meditation before that. And it sounds like now you do that in a daily practice.
Yes, I will confess that my practice, as probably anybody who, most people who meditate with any regularity will say their practice could be stronger, could be better. But that we're practicing, I practice pretty much every day. My goal is to, before I get out of bed, to have some sort of meditation going on, even so that way, even if I don't get to sit at any later point in the day, any more formal meditation, at least I've gotten something in. And my idea, I tried to pawn this off on my first mindfulness teacher back when I was starting, was that I had always lived life as a meditation. My wife gives me a hard time for this because meditation means, so to most people, the sitting practice. But even in MBSR, the idea behind a formal practice is to be able to live life more aware. more present, right? It's the informal practice of living where we want to take these traits of focus, of noticing, of an ability to shift our focus wherever we want to, and not to be blown about by the winds of whatever's going on around us. So my formal practice over the years, and what excited me when I first took the course back in 2018 was that it made me a better perspectivist. By practicing, by being formally, I was able to more quickly notice how I'm feeling, and more quickly seek to remedy or change that if I was not liking how I was feeling. So it made me a better perspectivist, having a
I
formal
can see
practice.
that. I'm curious, we have about 80 people or so on the call here. Type me in the chat if you also have a daily meditation practice. Love to see how many people. That's awesome. I had a question. Oh, Mavis just asked, how long is the MBSR course? Like, how long does that take to finish? Is that something that people can do online, or is it something that's currently just in person only?
No, we can do it online. Even before the pandemic, it was offered online. In fact, my second course I took online, and that was in 2019 before the pandemic. And that was, sort of in the beginning of the teacher training track for that. It's an 8-week course. It often will start with a week before. So it's really sort of a 9-week course that is an orientation, a meeting with the teachers. It has a 10th session, if you will, if you include the orientation as session 9, a 10th session, which is a 5 to 7 hours silent retreat in the course of the second half of the 8-week course itself. And each class is at generally anywhere from 2 to 3 hours long. So it's called 2.5 hours for 8 weeks is the basic model. It's an amazing course, and it takes individuals through both the philosophy, the psychology, the science behind why meditation might be a worthwhile practice for an individual, but also it takes us through several different practices. It's sort of increasing complexity from the most basic body scan or focused breath awareness of breath meditation, through turning towards the unwanted meditations to loving kindness meditation, body movement as a form of meditation. The yoga teachers who become MBSR teachers call it yoga, but the rest of us who are not formally trained in yoga call it mindful movement, because our bodies, as it turns out, and this I learned in MBSR, though it certainly applies to being a perspectivist, our bodies are the canary in the coal mine. When we're getting tense, sometimes our jaws clench, our shoulders hunch, our hearts race, our breaths become a little more shallow. And the more attentive, the more aware we are of what's happening in our bodies, moment to moment throughout our day, the more aware we'll be of how we're reacting to our world emotionally. And we can notice what's happening in our body and then say, oh, this is happening in my mind. Oh, I don't really care for it to feel this way. And then prospectively look at it, what's going on around me. One of our great practices, and this is in many other fields as well, is called the STOP practice. And it's an acronym for stop, take a breath, observe what's going on around you, and then proceed. It's really quite simple, but it's that pause that allows us to say, hey, getting back to where I started, do I like how I'm feeling or not? And if I don't, how do I want to change it, and how can I go about changing it? How can I look at what's going on a bit differently and move on from there?
I think it also starts with the desire that you want to stop it. Yeah, and because if you don't have that desire, it's not going to work, right?
Absolutely. We need to want to do it. And in Practical Perspectivism, in the book Choose Happiness, I list out 10 precepts basically, and the 7th, 8th, and 9th are: you have to want to change it, you have to want it to be different, and you have to want to do the work of it. And the work of it is hard, but not hard. We do it all the time. We live perspectively all the time. We're constantly changing how we look at things all the time, sort of a bit randomly and often on purpose. This is just doing it actively. This
Yeah.
is saying, okay, I notice I don't like how I'm feeling. I don't want to feel this way. I want to feel differently. And then doing that work to find different ways to look at it so that we can feel differently.
Is there a book um that you find inspiration from that has helped you besides
Uh,
your own?
yeah, it really started with Baba Ram Dass's Be Here Now, which actually came out in the early 70s. And my older brother, who was practicing TM, Transcendental Meditation back then, had given me. And it really, again, talks, if I don't have the book here right here with me, but the cover of the book, if anybody's aware of it, says be here now, and it says remember, be here now, remember, be here now, remember, be here now, which is mindfulness. He wasn't even calling it back then, but it's mindfulness. So that sort of insight introduced me back then to this. Several other books, sort of too innumerable to count, but one of my set of favorites is a book called Grooks, and there's Grooks 1 through 5. And these are by a gentleman, Pierre Heen, who was a Dutch inventor, mathematician, activist. And he wrote these short little aphorisms, little poems that really present mindful perspectivism in such a simple way. For example, he's got one that's called Thoughts on a Subway Platform. And it goes, it ought to be plain how little you gain by getting excited and vexed. You'll always be late for the previous train and always in time for the next. So when you're standing there on the subway and you run down and the train pulls out and you're, I'm mad, I'm pissed off, oh my gosh, I'm going to be late. Well, there's going to be another train. If I saw the train pull out or pulled out a minute before that, I didn't see it. It pulled out before, and there's going to be another train. So these little poems are always kicking around in my head as reminders
Yeah.
that there's other ways to look at it.
One thing, Jeff, that I do to help me overcome being upset in traffic or someone cut you off or all that stuff is, and I do really believe this in the next life, and I believe in the next life, that we're gonna have our eyes open to all shitty things that have maybe happened to us were actually a blessing to protect us. That person who cut me off in traffic, who slowed me down, might have avoided an accident that I would have been in, and so, but that's how I get through overcoming when I start to get upset, that I'll see a bigger picture lit in my next life.
That's a beautiful way to look at things. And it reminds me of a story that I included in Choose Happiness that I found in another good friend's book who suffered from struggling with uncertainty when this is most of life is uncertainty. And it's an ancient story out of China about the lost horse. And if anybody knows it, very briefly, a farmer has one son and one horse, and they're otherwise poor. One day the horse runs away, and all his neighbors say, "Oh my gosh, that was terrible! What bad fortune!" And he goes, "We'll see." Week later, the horse comes running out of the mountains with 20 other horses following him. As he's now got all these horses, and his neighbors say, "Wow, what great fortune!" We'll see. The son is trying to break the horses so they can be useful around the farm. He falls off, breaks his leg. Can't help on the farm anymore. The neighbors come around. Oh my gosh, such terrible fortune. We'll see. The king comes riding through, conscripting all the young able-bodied men for the war. The son, who with the broken leg, doesn't get taken away. Neighbors come around and say, "You're so lucky," So we never really know in the moment. And part of that is accepting that it's hard to know in the moment whether this will be good or bad. And that is judgmental in the first place. Things really just are, right? It's we, Shakespeare said it 500 years ago, there's nothing either good or bad, but thinking makes it so. Things just are. And if we could get to a place remembering that things just are, and I could choose how I want to look at them, good or bad or not, any, then we can move forward with a little more confidence that we choose to do what we want to do, and things will be what they are.
That's great. I'm still kind of on the STOP acronym. I love that. And I find that so many people actually get that high from being in that emotional moment of whatever's happening in the world and their life. Relatives, friends, like so many people can cause us to get into that moment where we get that high on the adrenaline or the cortisol. And I love the stop and being in the moment, the remember. We have something that we say, it's common to say, be present. Or one thing we like in this group is be where your feet are.
Yeah, I love the be where your feet are because it puts us back into our bodies. It's why the breath is such a basic part of most meditation practices, and the stop practice, take a breath, right? The T and stop is take a breath, because it puts us back in our bodies, and our bodies and the breath are always in the present moment. It's our minds that travel to the past, reviewing, perseverating on things that have happened, catastrophizing about the future. So our brains are the thing, our minds are the thing that go time traveling. We, our bodies, are always present. You know, it's great that we want to be present, and people will respond, well, of course I'm present, I'm here. What do you mean? They're really not recognizing that their minds are still traveling, that their bodies are present. Yes, they're right. And that's why it's so good to be able to have practices that bring us back into our bodies.
Yeah, it's amazing what taking a breath, an intentional breath, can really do for our mindset and just create that shift that is sometimes much needed.
So you get back to me and being an anesthesiologist. My specialty in anesthesia was obstetric anesthesia. So I worked with women and families having babies, and breathing is a big part of going through labor as well. So being able to daily refocus my patients on their breath was just integral to my being.
Mhm.
It just kind of recenters everything.
Yeah.
I'm
Jeff,
curious, do you have a podcast that you like to listen to? You've mentioned a couple of books, and don't worry, some people asked in the chat. We will, in our follow-up email, we'll put down any of the books that Jeff has recommended here too with their authors. But do you have anything that you go to kind of remind you, where you are?
Well, I'm sort of practiced at this point that it comes up. I go places to learn more. One of the places that I've gone to, and I've never really latched onto podcasts, but recently I'm starting, as I'm trying to go to the gym and work out a little more for my own physical health. Two that I could say that I enjoy are The Happiness Lab by Laura Santos.
Mhm.
Laura Santos is a Yale professor who introduced a course back in 2018, just when I was getting started with MBSR, and a few years after I wrote Practical Perspectivism, Choose Happiness. And the course was on the science of happiness, or the science of well-being. And she thought, she introduced to her directors and said, yeah, go ahead and give the lecture. They thought maybe they'd get 100 people signing up. They had over 1,200 people sign up for that first lecture series back in
Wow.
2018, and it's exploded ever since. There's now they teach it at Oxford, a sister course of the same, and they're doing research on their work, which is beautiful. She's an excellent podcaster, and her podcast, The Happiness Lab, is wonderful to listen to. So I've gone through that quite a bit. Another one is 10% Happier, I think, is the podcast. Dan Siegel was a ABC newscaster who froze on air from anxiety, from fear, and then sought out other things that he could do to allay that fear and work with it. And he found mindfulness, and he's a good television and voice personality. So he runs a very nice podcast as well on these themes.
That's
Jeff,
great.
talk about, I know a service, doing service to others is also a great distraction of all of the crap that's always going in your life and I know it helps me to say what I'm going through isn't as bad as other things are out there. Talk about that a little bit.
Yeah, so it's a great concept of service, that we talk about having meaning in life as well. I'm my wife and I fell in love well over 40 years ago, but over many things. But one of them was a conversation we're having with a lot of our friends about altruism, and does altruism really exist or not? And it's we still have this conversation with friends, but it's sort of almost a little meaningless in the end. The point is that to recognize that doing good for others makes us feel better. Okay, I feel good when I do good out in the world. So that's, again, now a fourth positive reinforcing feedback I get, right? Along with, I just feel better myself whenever I'm being more mindful. And living as a perspectivist, it works better and I engage better in my world, with my world. But when I do good for others, I feel better. So yes, wherever we can engage in that is a positive benefit for others, obviously, but also for ourselves. A corollary to that is, there are situations in which it's easier to be happy and situations in which it's more challenging. Our world situation, our country situation right now might be a little bit more challenging to find happiness, to choose happiness, but it's still possible. When we create happiness around us, when we do for others and ease others' burdens, it's an easier environment for our own selves to find happiness, to be happy within ourselves. It's less work to get there. So there's now a fifth or sixth, I don't know what we're up to, in positive feedbacks by creating those environments for others as well as for myself to be happy in.
Positive feedback. It's like a positive feedback loop.
Yes, yes. I was just reading Joseph Goldstein, also a great book called Mindfulness. Joseph Goldstein was one of the founders of the Insight Meditation Center up in Barre, Massachusetts, and around the country. There are several as well. And he talks about the idea that once we can make wise choices, we feel better, which allows us to make more wise choices, which allows us to feel better. And it becomes a positive feedback loop. It reinforces itself very easily.
Yeah, right there's the practice.
Yeah.
Reinforces the practice.
Right. Remembering, noticing, doing it. Oh, yeah, this is better.
Yeah, you suddenly start to feel better once you once you stop.
Exactly.
Take that deep breath. That's great. Thank you for sharing. Do you have a routine in your day that kind of keeps you going on that, or do you just live your life and it's just all in hand? I think we could all learn lots of lessons here today.
So I'll say no, I don't really have a routine. The routine is to live life, to get out there and live it, and to practice noticing how I'm feeling. That once we do it, again, this comes back to that positive feedback loop. As I started doing it, it became so right feeling and productive for myself that I kept doing it. And the more I do it, the more easy it is to do. The more quickly I will notice when I'm not present, the more quickly I'll be able to refocus my awareness, my attention to this present moment, to how I'm feeling and what I'm doing, and change that if I wish to. So I've never been much one other than in work when I need to do that for routines, for getting into habits. My wife also likes to push me to break habits when I've developed them. And that's a good practice as well, though it could be seen as a habit, I guess, a practice of doing that. But things we do habitually, we have a tendency to think less about, to be more automatic, and to be less present for. We just do them out of habit. And sometimes that's very productive and we can be very efficient, but other times we can get lost in that and lose our ability, lose our momentary presence, present moment awareness. So being able to notice things that are habits and break out of them is a good practice too.
Absolutely.
I know music affects everyone's emotions, and that we talked about that a little bit in our pre-interview, and that, what are some things that if you're starting to go there, that we talked about, taking a deep breath and things like that, but why don't you talk a little bit about the music and if you have something that you can go to help pull you out of that gutter?
Yeah, thanks for bringing that back around. So, people ask, what sort of tricks or practices can we do to enable us or enhance our ability to be perspectivists? And one of those that I like very much, and this is where it came up, is either lyrics or nursery rhymes, whatever it is, whatever song it is, something that will come to you easily, a song that you love, or a nursery rhyme that you loved, or just even counting can do it sometimes. But when I notice myself getting a little stressed, a little out of control, a little caught up in perseveration or ruminating, I'll just divert my mind to, if I can't think of anything else, to a song, to lyrics, to a nursery rhyme, to any of these grooks that I talked about. And that will be that's a sort of an off ramp for my mind to divert itself. And even the Buddha said, sometimes just think of something else, to divert my mind from the cycle, this loop that I'm in. And once that loop is broken, I can then go on to think. I could go back even and think about what I was thinking about more clearly from a different perspective, choose a different perspective, or just move on to the other things going on in my life that I want to be paying attention to and choose those because I've broken that cycle. So lyrics, music are really fabulous as a tool for that. And no reason to think that there's anything wrong with that, anything that helps us. We started, I think it was Betty was talking about use our tools, right? We use them in our work. We use them in our production. Why not use them in our life for our own sanity?
So, do you want to share what your song is?
Well, I'm a deadhead, and that may resonate with you West Coasters. But my world favorite song, lifetime, is Sugar Magnolia. I have a vision of heaven for me. It would be dancing to the Grateful Dead to the end jam of Sugar Magnolia, and I could do that forever. So I just start whistling or start singing, and I'm transported somewhere else, and then I could come back to here in a completely different mood.
I love that. That's great. Um, okay, so we always end our calls with just some kind of fun facts, and it some of them inspire thought and some of them don't. But I want to thank you for everything that you've shared here because this has definitely been, I think, a great timing, just for what's going on in the world. And I think we have more often that we need to just shift our mindset. So on to my 6 at 6 is what we call it. And the first one I'll ask, do you have, or if you could travel in time, forward or backward, and go anywhere you wanted, where would you go and why?
Well, having just said what I said, I'd probably go back, even though it was a deeply interesting time. I think I'd probably go back to 69 in San Francisco and
Nice.
be around 67, even be around the summer of love. I mean, that's where I've always felt I fit in best, even though it was only
Seems like
7.
it was a good, happy time.
Where's your tie-dye shirt, Jeff? Where's your tie-dye shirt?
Closet
You're out
filled.
of character.
Yeah.
Oh, it's great. Okay, now, so I understand. So, this next question I usually ask is if you could choose a beach house or a mountain cabin. And I think you might have a little bit of both in lifestyle, or you definitely have two different homes that are different in style. Am I correct in
Yeah,
that?
so we've got our apartment in New York City. My wife is born and raised Upper West Sider, so she's most comfortable there. But we also have a house where I'm sitting right now on Fire Island, which is a barrier island off the south coast of Long Island. And I'm pointing behind me. The ocean is really 100 yards that way. So
Wow.
I spend most from May through into November here, and it's amazing. So yeah, we love the beach. I do love the mountains, and we don't get there enough. So that's something I continually try to push in my life.
That's great. So, where you like to spend more of your time on the island, she likes to spend more of her time in the city.
Well, yeah, I mean, she loves it out here as well, and we do spend our time together out here for May through November. But she's, I think, most comfortable in the city.
It's
Yeah,
nice that you have both options.
yeah, very
All
lucky.
right. Favorite kind of ice cream?
I'd say probably something like Rocky Road. I like a lot of flavors. I like chocolate. I like marshmallow. I like nuts. So yeah, Rocky Road.
Oh, that's always a good one.
Mhm.
What else, John?
Can I throw in vanilla fudge swirl in there too?
Oh, yes,
And sweet with
absolutely.
vanilla and chocolate together.
What about favorite movie?
Yeah.
Favorite movie? Good question. I was just looking up the lyrics to Let It Go this morning. So Frozen is a wonderful movie. There's so many really good movies. But Frozen, I like for that particular sense of being able to see yourself, understand yourself, and let it go, let the rest of the world go, and all the expectations, and just be who we are. So let's go with that for the moment.
Okay. So, your secret celebrity crush when you were growing up.
Bridget Bardot.
All right, that's a good one.
Mavis is over there clapping and having a
Yes.
celebration.
I'm
Yeah.
not really even sure where that came from, but Bridget Bardot.
Oh, that's fun. Well, Jeffrey, it has been very fun having you on the call. We thank you so much for your time. And thank you, everybody who joined us this morning.